My name is Joy Gonzalez and my topic is randomized trial of posaconazole and benznidazole for chronic chagas disease.
Chagas disease is a potentially life-threatening illness transmitted by the kissing bug, which carries the triple-parasitic parasites. It is mostly found in Central and South America. It is estimated that it infects as many as 11 million people. The kissing bug often bites victims on their lips during sleep and leaves behind parasite-laden feces. The disease has two phases. A 2-month acute stage is marked by symptoms including headache, fever, diarrhea, vomiting, fatigue, body aches, skin rashes, and swelling in one eye. Up to 90% of cases are cured when treated during the acute phase. If untreated, the disease progresses to a lifelong chronic phase. The parasites can affect the heart and digestive system, causing damage in these areas, and may eventually cause heart failure and death. Cure rates increase with time.
Chagas disease is an illness spread by insects. It is common in South and Central America. Infected blood-sucking bugs, sometimes called kissing bugs, spread it. When an infected bug bites you, usually on your face, it leaves behind infected waste. You can get the infection if you rub it in your eyes or nose, without wound or a cut. The disease can also spread through contaminated food, a blood transfusion, or donated organ or from mother to baby during pregnancy. Chagas disease symptoms. Chagas disease has two phases, acute and chronic. The acute phase may have no symptoms or very mild symptoms. Symptoms include fever, general feeling, malaise, swelling of one eye, swollen red area outside of insect bite. After the acute phase, the disease goes into remission. No other symptoms may appear for many years. When symptoms finally develop, they may include constipation, digestive problems, pain in the abdomen, swallowing difficulties. Chagas disease treatment. The acute phase and reactivated Chagas disease should be treated. Infants born with the infection should also be treated. Treating the chronic phase is recommended for both children and adults. Adult patients should talk to the doctor about whether to treat chronic Chagas disease. Two drugs are used to treat this infection, benznidazole and methadone. Both drugs often have side effects. The side effects may be worse in older people. Chagas disease is a common disease, yet every individual needs unique treatment and care. We encourage people with Chagas disease and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle.
The treatment currently available options for Chagas disease are limited to benznidazole and nifurtimox, which have been associated with low cure rates in the chronic stage of the disease and which have considerable toxicity. Posaconazole has shown therapeutic activity in moderate models.
We're hearing reports today about a medical mystery some scientists are calling the new AIDS of the Americas. The name of the illness is Chagas disease. You can treat it, but you cannot cure it. It can be fatal, and researchers say it's spreading now at an alarming rate. Trace Gallagher has the details from our West Coast newsroom. Trace?
But to treat it, Megan, you got to catch it early enough, and the problem is just like AIDS, Chagas is very hard to detect, and it has this long incubation period with no symptoms. What happens is these blood-sucking insects actually send a parasite into your blood, right? And it releases the parasite, and then it makes its way to your heart where it can actually multiply. It's called a kissing bug. It stays dormant for years, and then it shows up as heart disease, potentially a heart attack. As many as 8 million people have Chagas. Mostly shows up in impoverished areas like Bolivia, Mexico, and Central America. But experts now estimate that 30,000 people in this country are affected. Most of those are immigrants. Now, it can be passed through blood transfusions. or you can pass it on to your children. It has similarities to the early spread of HIV. Here's Dr. Manny Alvarez. Listen.
What we have to realize is that the diseases of the tropics, which is in our backyard, and there are many of them, right, are becoming more prevalent in the U.S., and I think that's a factor because the world is opening up more.
Right. Can't really get rid of this thing. You have to diagnose it and then treat it. We should point out that Charles Darwin, theory of evolution, his death has been a medical mystery for a very long time, and now there's a lot of new research that says it's possible that that man also died of chagas, becoming much more prevalent in this country, which is a frightening scenario.
It really is. Gosh, Trace, thank you.
In conclusion, posaconazole showed antiretroviral activity in patients with chronic Chagas disease. However, significantly more patients in the posaconazole groups than in the benznidazole groups had treatment failure during follow-up.